report out, slightly new format. Harrison's leading today, so it'll be different, whatever. Just want to remind everybody about report out and what it's all about. So Leeds improvement method, if you can remember, the blue strategic triangle sits right at the bottom of that blue strategic triangle that we have in the trust. And at the very top, we have that single word that I talk about all the time, patient. And in between, we've got a number of things, but firstly, our vision to provide the highest specialist and integrated care. Specialist, the real Gucci end of stuff, tertiary, quaternary referrals, integrated care. So for the population of Leeds, that's the integrated element. Then if you remember on the blue triangle, next row down, strategic priorities, 5 of those. Integrated partnership services we're going to develop. We're going to ensure financial sustainability. We're going to develop and support our people. We're going to focus on care quality, effectiveness, patient experience, and the final one is continuous innovation and inclusive research. And if you remember, beneath that one, there's the Leeds Way values. Remember those 5, and below that, Leeds improvement method. So all these projects that we see on a Friday, all in however big, small, meaningful way, all help us deliver on those bits of the strategic triangle to that patient at the very top. And you know the golden thread that sits beside, it's like a golden worm if you look at the slide. That is the golden thread. It's all the way through the organisation. And this is why Julie and Helen are here today. 5 minutes each. Just remember your questions as you're going through, because if we can have a few questions from quarter 2, that would be fab. So without further ado, Julie, you're on.
It's nice to meet everybody. Hello, my name's Julie Lenny and I work in HR and I'm part of the recruitment team. I'd like to share with you today how I've used Leeds improvement method to develop and implement an e-learning training package to support the recruitment selection policy. So the challenge was to develop an inclusive recruitment e-learning training package to support the recruitment selection process. A recruitment selection policy was also introduced trust-wide in June 2024 with the intention of ensuring our recruitment process is fair, inclusive and free from bias. We want our recruitment to reflect the diversity of our communities. Policy is bold and it makes recommendations to ensure everyone's given the opportunity to apply for the role if they have the right skill, experience, qualification and knowledge. And we have a toolkit that underpins the policy. To strengthen the policy, we wanted to offer trust-wide training and guidance based on best practice to everyone involved in recruitment. And we wanted our training to offer one-stop shop for information and to raise awareness of inclusive recruitment and of where potential bias and barriers can creep into the process. And also, we're very aware that our staff survey indicates there's a perception that recruitment is unfair. With the introduction of the recruitment selection policy, the toolkit and the training, we hope to alter the perception and improve staff retention. So inclusive recruitment training has been developed to support the new policy. However, it didn't start as an e-learning training package. The idea was developed organically during implementation using the PDSA model and stakeholder feedback. The PDSA model, which is to plan, do, study and act, at each of these stages, we were confident that the training supported the policy, and the policy provided recruiting managers with guidance and a framework to work from. So LTHT now has an inclusive recruitment training package that offers support and guidance from the start of the recruitment journey through to the end, and it's broken down into the different parts of the process to make it easier to use. And because you can access it via e-learning, it can be done to suit your style, pace and time limitations on whoever is completing it. So the training encourages everyone involved in recruitment to consider inclusion and fairness at every stage of the process. And here we've got just a few pages from one of the training packages. So to date, over 2,000 colleagues at LTHT involved in recruitment have completed the inclusive recruitment training package. And in a recent survey, we asked if the policy and the training has helped to ensure you consider inclusion throughout the full recruitment process. 78% of respondents said that it had, 11% said maybe, and 11% said that it hadn't made a difference to their recruitment practice. And we've got some of the responses just down there. We won't see the full impact of the training yet for another year or so, but we are monitoring it. So what went well? The use of the PDSA model worked really well for us, and we used it at all key stages of the policy rollout. It helped us identify what we needed to do and how we could make improvements to underpin the policy, and that resulted in a toolkit and the inclusive recruitment training. Feedback was equally as important, especially from our staff networks. We wanted to ensure the training was accessible, useful, and brought all aspects of recruitment together in one place. The training raises awareness of inclusive recruitment and it underpins the policy and the principles. And we know it's raising awareness because we're having many more conversations and discussions about the fairness of our recruitment practices. Our inclusive recruitment training has been shared with other trusts and ICBs, and some of them are planning to use it in their inclusive recruitment journey as well. So what would I do differently? It's been a lot of hard work, but I wouldn't change the PDSA process. It's been really helpful, and it's helped shape the toolkit, the training, and improve the training package. And my key learning from this is not to be afraid of feedback, even if it's negative. It can be used as a really powerful tool to improve your product. So I will continue to review and update the training package using the PDSA model, and also by incorporating user feedback. Thank you very much for taking the time to listen.
Thanks, Julie. Really good. Lots to talk about. We'll pick up questions at the end, but I hope you can all see which green box, which strategic priority that feeds into immediately. Thank God. Love it when a plan comes together. Helen, you're on.
Yeah, hello everybody. So I'm my name is Helen Biggs. I work within renal in AMS. I'm one of the matrons there. So my project was to standardise catering provisions across the dialysis service, with the aim to reduce food waste within the service, but to also ensure that we have an equal level of service for each patient. So first, we'll just to introduce our service a little bit, really. So we are a very large service. So we provide dialysis to over 700 patients across 8 units. So we have 7 satellite units and then 1 unit which is based at St James's Hospital. So we've got units in Halifax, Huddersfield, Dewsbury, Pontefract, at Beeston, and 2 at Seacroft. So these units provide dialysis for our chronic kidney failure patients. These patients generally come to for dialysis for 4-hour treatment 3 times a week. So obviously, being such a large service, and also dialysis is very, not environmentally friendly. So just to give some context, so per 4-hour single dialysis session, it uses about 150 litres of water. Also, all our patients, come to the units on transport. Sometimes they come from quite a long distance. So on average, a haemodialysis unit emissions is equivalent to 93 homes. So as like a leader and a clinician, I think it's we have a responsibility to reduce our environmental impact, and obviously it links into obviously one of our 7 commitments. Because of that impact, we are fortunate enough to be supported by KQIP, so our Kidney Quality Improvement Partnership, and they are leading a project called Trunk HD, which is trying to reduce unnecessary carbon within haemodialysis. So a few of our kind of clinicians have been leading on a project looking at reducing our acid concentrate. So changing our concentrate use for our patients, meaning like we can use less, and then we have like less deliveries, obviously less trucks coming to our units filling us up with our acid. So that's a project that's been led by our technicians and also 3 of our senior sisters. So I went along to one of our sessions. It was about a 3-hour session where you can see the process map that out. At the end of it, we had about half an hour spare. So we just started talking about other waste across the service. And Tim there, one of our charge nurses at RNS, mentioned that the housekeepers throw away biscuits at the end of every day. So they have packets of biscuits that they put in a tin in the morning and they take round to the patients. And at the end of the day, they throw away the biscuits, which obviously I was quite horrified at. And the reasoning being because they're not allowed to keep them overnight. And then Raina, one of our sisters who leads one of our other units at Seacroft, obviously just down the corridor, they don't do that. They keep their biscuits. So then that kind of led to a conversation about all our practices across the service, because we're quite well spread. And we've got 2 units that sit in Mid Yorkshire Trust. We've got 2 units that sit in Calderdale. One of our units is above a GP practice managed by NHS Properties, and then we've got 3 units that sit within our estate. Obviously, the practices are quite different and vary, and then it just opened up that kind of conversation, and I realized there was lots of kind of myths which I wanted to debunk. And the other thing that I was quite concerned about, I mean, we don't have any data, it was like anecdotal, but a couple of the sisters seemed to think that our patients were also kind of being influenced about what unit they want to be dialyzed at because of the food choices. So that led to kind of this project looking at our food within our dialysis service. So our actions. So the first thing that I did was I suppose knowing our business, and however visible you are, however many waste walks you do, if you're not there when the housekeepers are throwing out the biscuits, I'm not going to know about it. So I gathered all the information from all kind of sisters and senior sisters about what was happening in each unit. And then I had a meeting with Martin Lowe, who's been fantastic and really supported me throughout this. And we just debunked a few of the myths and made some immediate changes. So the biscuits, so obviously we didn't need to throw them out. We could keep them, but what they were doing, they're mixing the biscuits. So now we separate them. As you can see, we just have the ball ones separately, because some of them obviously have milk in, some of them don't. So in terms of like patient safety, so we do that now. Spoons, so we were using wooden spoons at Pontefract because they don't have dishwasher. Apparently you can't use metal spoons if you don't have a dishwasher. Again, another myth. So we've got rid of our wooden spoons and we just use the metal spoons for like teas and coffees. And then one of the bigger variations was generally the food we serve. And we kind of knew this, but I didn't know the degree. So across kind of Halifax, Huddersfield, Pontefract and Dewsbury, we were just serving tea and biscuits. And then at RNS, we were serving sandwiches. And then at J48, we were serving sandwiches and toast. But that actually even varied within the shifts. So the early shifter patients would get toast and sandwiches. So they did really well. And then our mid-shift patients just got sandwiches, and then our evening patients got a choice of toast or sandwiches. So obviously looking at this at the region as well, speaking to my matron colleagues in other trusts, we were a little bit of an outlier. A lot of the trusts have got rid of their sandwiches for dialysis outpatients a couple of years ago. So I got together a small working group with our dietitians and our clinicians, and talked about kind of standardising our service just to tea and biscuits. So the general consensus was that we did want to do this. There was some concerns from our dietitian colleagues, just about kind of the long wait for transport and the risk of our patients with their nutrition. But obviously, I suppose the argument back was, but our other patients, our other units are not having sandwiches and toast. And so we then did have a conversation, do we need to put toast and sandwiches in the other units? But then we decided to go ahead with biscuits and tea and coffees. But then we would obviously check in with the clinical teams that if we did have any patients that we were worried about, obviously they would have conversations with the dietitians and then look at their individual management, and maybe then we start prescribing supplements if we needed to on an obviously individual basis. So the next thing that obviously we need to look at was patient communication. So I wrote to all the patients to explain the change and why we're doing this change. And we decided to give them 3 months notice. So I ran this letter by our comms team, and also Leeds Health Watch, who were really helpful. And the comms team, our Leeds Health Watch, advised us to put in the costings. Obviously this change was going to save us some money, and at first from our point of view as clinicians, we kind of didn't want to lead with the money side of things, but they said it's really good to be transparent to our patients and to be honest, so we did put that information in. So coming up to the change, we decided to give them a date of the 1st of November. So this has been going now 3 weeks, because we were taking away our catering services for all our kind of about 700 patients for our outpatients. I informed our housekeeping that we weren't kind of going to be ordering any food, and we did realise like a week before, we do have some of our inpatients from our renal wards J49 and 50 that come over to J48 for dialysis, and obviously we still need to provide food for them. So we suddenly realised that we did still need to order a small amount of food, So I did a walk round with Martin Lowe and Cameron, keeping supervisor, just to fine tune what that would look like. And then also we kind of realised it was important that our patients come over from the wards, that if we could try and reduce waste as well. So if they come over and they wanted a hot meal when they're on the ward, to try and for the clinical teams try and plan ahead. So if they were going on dialysis in the evening, they would order the hot food for lunchtime and then try and order the cold, like the sandwich or the toast on the evening. So we were like wasting kind of less hot food really. So our outcome. So obviously the main big change is that we've obviously standardised our practice with just having biscuits and hot drinks, and that's been from the 1st of November. So this change is saving us £33,000 annually, which is is a lot of money. So one of the things I think as a service we were concerned about was, I suppose, the amount of complaints and PALs we were going to have. So a while back years ago we used to have toast and sandwiches at some of our satellite units, and that was changed to biscuits, and I think there was a lot of complaints at the time, and the Kidney Patient Association was involved. So I think there was a little bit of fear from the service about kind of how many complaints and the reaction, because we kind of knew that this wouldn't necessarily be popular. So I did work with patient experience team and just kind of warn them that we might be getting some PALs through. But actually I'm amazed we've only had one PALs since the letter went out about 3 months ago. So within our service, we do have friends and family available, but obviously because our patients come in 3 times a week for a long time, that's not really a well-used kind of method of patient feedback. So we use our PREM surveys, which is our kind of kidney patient kind of metrics. So we've just had a recent survey. It's an annual survey. So we'll be getting back the feedback soon. So I'll be keen to look at that as well. So what went well? So lots of clinician engagement, really supported by our consultants Emma Dunn and Mark Wright, who's our clinical lead for dialysis. Also input from our comms and Leeds Health Watch. And I actually wasn't aware about Leeds Health Watch. I was discussing the changes that I was going to implement with my head of nursing, Vivian Lewis, and she suggested, "Oh, Helen, why don't you contact them? They're really helpful." So that's definitely kind of a resource I'll use again if I was to implement a change. And also less patient dissatisfaction than expected. And I think that might be due on reflection, on being honest about the cost savings. And obviously, our patients, they watch news, they realise what's going on in the NHS with financial pressures, and understand, that's one of the reasons for the change. So yeah, so what I would do differently, I think we would have done this sooner, really. When I was making the change, everyone was like, "Oh, Helen, like, are you the one that's going to be like taking away the sandwiches and the toast?" So I think I would have done it sooner. And I think we should have done that on hindsight. I think I would have involved the dietitians slightly earlier into the discussions, because they did have a lot of concerns that we had to kind of iron out. And then in terms of future plans, so this work with the Trunk HD work is obviously ongoing. There's lots of other things I know Steph and the clinical teams want to look at, including like reducing like patients bringing their own blankets, patients bringing in their own kind of cups, and looking for other opportunities. There's still some things catering wise that would be good to kind of try and iron out. So at Pontefract, they still use like the the mini kind of milk containers rather than having obviously fresh milk, because that's all our supplies team can give them, because they sit in another trust. So it'll be good. There's a few little bits I kind of want to look at. And then also we want to get some further patient feedback as well. And I think that's the end. Thank you.
Helen, thank you. Great project. I've just got to say, whoever knew a biscuit could survive overnight? I've never lived in that house. But I think the thing that comes across really, it would appear to be quite a small project, yet had a massive impact, and to deliver it, it actually requires many, many levels of work. But 33,000 quid. Helen, can I, just while everybody's thinking,
yeah,
can I ask you a question? Have you got more confidence to go again next time?
Yeah, absolutely. I mean, it was funny because the week that we made the change, everyone was like, "Oh, I'm going to be on annual leave next week," and I honestly, and my fear as well was for the clinical teams, the nurses, I was worried they were going to get a lot of flack and a lot of grief, and I wanted to kind of protect them from it really. We do get, because of the kind of nature of dialysis in our patients, we do get, I feel you know, for some areas, we do get quite a lot of inappropriate behaviour and conflict management with our patients. So I was a little bit worried about, you know, going ahead. I definitely would have more confidence next time. I think as well, if you have the right intentions to make, you know, service fair, and I think you just need to go ahead with it. And I just can't believe we've had one pause. You know, I honestly thought we were going to get about £100. You know, and we didn't. So I was like, clearly we're doing the right thing, and you know,
done it the right way.
Yeah.
So I think, you know, the nirvana for us is to have 22,000 people, each with that desire to improve those little bits that make a difference. So we've got 2 projects, one around EDI, PDSA, learning. We've got another one that saves biscuits. Whoever knew you needed to separate them, but I understand why now. So I'm hoping that's whetted everybody's appetite. And James Goodyear, straight in.
Yeah, thanks, guys. Great presentations. It was a question for Julie, actually, just about what kind of metrics are you monitoring moving forwards, Julie, to try and see the impact of the new policy and training?
Mm-hmm. We think long term we'll be able to see, we will hopefully see an improvement in the RES, so the workforce race equality standard data, and the WDES, so the disability equality standard data as well. But short term, we monitor what's going through recruitment, and because we now have a framework, we can see exactly what's going through, and if it's not following the policy, then there are questions to be asked as to why it's gone outside the policy. There may well be a very good reason, but we think that is fueling the fact that people think that recruitment is not always fair. So we hope to see in the staff survey that will come down as well.
So you can see that kind of consistent implementation in flow. Yeah. Great.
And Julie, just while we're waiting for more questions, I can't emphasize how important it is that the population we represent is represented by the people who work at LTHT. It's massively important, and being able to, you know, I suppose educate ourselves around what we need to do differently in our recruitment process is absolutely vital. It's the second time I've heard about it this week, so it's clearly hitting the mark. So can I ask any other questions, comments from anybody else? Jenny?
It's not a question, but I mean, it's just a comment. Thank you both for really interesting presentations and the level of work that's gone into where we've got to. And it's actually really useful for me to hear, Helen, the kind of the level of, I suppose, engagement around the finances in particular. Sorry, I should have introduced myself. I'm Jenny, Director of Finance, Jenny out. So that's really helpful to kind of hear that coming from you, as well as, you know, I think that's what goes on, but it's really nice to have that confirmation. And just to say, Julie, I very recently recruited in my team, and so had some of that experience of using that process, and it's, yeah, it really made me, I think it made me think differently. So really helpful just from a kind of user experience rather than necessarily having a question about it. But yeah, thank you both. Really interesting.
It's good to know. Thank you.
So a bit there about unconscious bias and all of us being aware that we do have them. And I think that the next bit for me, previous organisation I worked in, we worked out how much it was to recruit any member of staff, and each member of staff to recruit was in excess of £2,000. So if it improves our recruitment and retention, Julie, you're on a winner. Now, and I'm really aware that nobody else has got their hand up. Is everybody ready just to crack on with the rest of their Fridays? Seems that way. Thank you, Julie. Thank you, Helen. Rowan, you've disappeared, but thank you for pulling it all together. Have great afternoons, everybody, and good weekends.
Thank you.
Bye.